Hello and welcome to SSP TV. I'm your host today, Jeannine Lesante, and this is called Ask the Doctor. We're going to learn a lot today about the heart, keeping you alive longer. And we are with Dr. Mahesh. He is with Penn State Health. He is a cardiac and transplant surgeon. So Doc, thanks for joining us here on SSP TV to talk about health, to keep our heart healthy and pumping. And so tell us what you do. Tell us a little bit about your background.
Thank you, Jeannine. I appreciate that. And I want to thank you all for this opportunity to come and do the show. And I'm a heart surgeon, and who also does all kinds of cardiac surgery, all kinds of heart surgery, and also heart transplants, and all machines also to support the heart. And I do this at Penn State Hershey Medical Center. So I've been here in Penn State since December 2020. Right in the middle of the pandemic, I moved over from the United Kingdom. I was an attending cardiac surgeon and transplant surgeon in London in the United Kingdom. I was practicing there for like 6 or 7 years before I moved over. And before that, I was an attending in Glasgow, again in the United Kingdom. So with this background, I moved over to the United States. And here I essentially do the entire gamut of heart surgery, all types of heart surgery I do, be it complex valve conditions, complex rhythm problems, or your day-to-day coronary bypass grafting, or if it is a complex second or third time procedure, a redo operation as is known as, or any patient that needs a special heart device like a mechanical circulatory support or ventricular assist device or an impala, I do all of that at Hershey. And if somebody has got a dilated aorta, for example, I will deal with that at the same time. So I'm what you can say, a true all-rounder in terms of heart surgery.
Lots of experience.
Lots of experience and lots of training that went into getting this experience in the past. And so I provide this entire spectrum of services at Hershey.
Let's talk about the heart. Most of us wait till we really are in dire need of health care. You know, oh, I have a toothache, you wait. Same thing with the heart. Sometimes we neglect our health because we're too busy to take care of ourselves, right? But, you know, the goal of the show is not to ignore your heart conditions, because things can be taken care of rather quickly before you actually need surgery.
Right.
Okay, so talk about a little bit about heart health.
Yeah. You know, it's very important you mention that. So people in general are nervous about going to a physician or a doctor. It's not the same thing like you want to go to a shop and you want to buy something.
Right.
People are really nervous when it comes to their health and their body, and they're worried about procedures being done on them. So if it was going to a doctor to find out for a general checkup, for example, even that would make people nervous, for example, because it would, you know, what if the doctor finds something in me? And then what if I have to have so many tests done to treat it? But here is my point on this. So it is better that if things are picked up at a much earlier stage, because it's much easier to treat them than having things picked up at a stage when you know you're really unwell, when your body fills up with a lot of fluid, for example, and you cannot move and you're short of breath and you got chest pain and you get dizzy every time you take a step or two. You know at that point you have to go to a doctor, and that's when you actually go to the doctor. And indeed, sometimes you end up in the emergency department. And when you do that, they do a whole gamut of tests on you, and they find that maybe the condition has progressed so far that we can no longer do anything. And you know, the first time you actually visit a doctor or an ED could be actually your last time. And we really don't want people to get into that situation where it's impossible to do anything at all, or whatever we do is essentially quote unquote palliative. We want to keep people healthy. The whole point, the whole focus of in this day and age, in this day of technology and internet, should be on people having their health more in terms of being well-being rather than as something to get out of sickness. So they should try and keep themselves more healthy rather than you know, go to a doctor when there's a problem. So I would go more in favor of people going out there, seeing their PCP and making sure that they're healthy. And if there's a problem with their heart, for example, have it dealt with at a much earlier stage. so that they don't get into problems later in life.
So with heart conditions, is that something with statistics you see in older people, or can it happen to younger people? Because I think the perception is that only old people need to worry about their heart.
Right, and that's a very common perception, unfortunately. But we find that heart conditions can start very early. They can start in childhood. In fact, they can even start in utero. So conditions are diagnosed when babies are born. There are various hospitals in the state and all around the country to treat indeed babies having various heart conditions. And once these babies grow up, they continue to and become young adults or adolescents and young adults. They continue to need procedures. At the next level is young adults who, like for example, we saw the recent famous football player who collapsed on the field and needed to be transported to an emergency department and had procedures performed. So that is an example where you have somebody who's in a prime of his life, who's actually a super athlete in a football field, and he collapses and has to be taken to a hospital. So you just know that these heart conditions are waiting to get you, and the sooner they are diagnosed, the better off you are at treating them. So you don't get into, if you're diagnosed at a much earlier stage, then you don't get into a situation where you collapse in a field, for example, or anywhere for that matter, and then you're rushed into an ED in an extremist situation.
And I'm sure you've seen that in your practice.
We see that a lot when people, youngsters, young people, adolescents, young adults, they don't necessarily believe that there's anything wrong with them until something just hits them out of the blue. And then they have to be taken to the ED, and this like a whole shock-like situation where not only is the body physically unwell, but the brain is also kind of adjusting to cope with the new facts and the new diagnosis and how to go about with the whole thing. So it becomes a whole different experience. And certainly, as you get older and older, it's even more important to watch your health and to go to a doctor and to make sure that you're checked regularly, so that at least on a yearly basis, and so that if there's any conditions that are there, then they are picked up much earlier, and you can seek treatment at an appropriate stage. Be it at Penn State, where we provide the entire spectrum of treatment that is possible, or be it at your local PCP and your local referring hospital. They can also do a good job, and if they want to transfer patients to us, that's also a good option.
Very nice. So when we come back, doctor, we're going to talk about some of the signs and symptoms if people think that they are having a problem with their hearts. And then later in the show, we're going to talk about some of the procedures that you do. Some are non-invasive, correct?
Okay, great.
All right, so stay with us right here on SSP TV. You're watching Ask the Doctor. Welcome back to SSP TV. I'm your host today, Jeannine Lesante, and you're watching Ask the Doctor. I'm here with Dr. Mahesh. He is with Penn State Health. He is a cardiac and transplant surgeon. We are keeping you informed on keeping your heart healthy, right, Doc?
Right.
And steps to keep your heart healthy before something happens that you need surgery. So what are some of the conditions, Doc, if we can pick up on what should we look for that should be alarming, that we should be calling the doctor? Because is it more chest pain? Is it shortness of breath?
Okay. Now, so we will first talk about the symptoms, as it were. So there are four, I would say, cardinal symptoms of heart disease. One of which is chest pain, this is the most common one. It's more of a central type chest pain. And it could be spontaneous, or most commonly it is precipitated by doing some kind of activity. Say, for example, you're doing heavy strenuous activity, or you're doing various grades of activity, and that's always classified into four classes. And if you get chest pain with very little activity or constantly all the time, then that itself is a signal of heart disease. But even if you get a chest pain with minimal level, with exertion, for example, that in itself is a sign of heart disease. Mm-hmm. So that is one of the main symptoms. The second important symptom is breathlessness. So if you do get out of breath for when you're doing any activity, for example, with increasing levels of activity, say for example, if you go up a flight or two of stairs and you start to get out of breath, then that's again a sign that your heart is struggling. It could be a sign of lung disease too, but more commonly it's a sign of heart disease if you start to get out of breath. And as you get more and more sick, you get breathless with progressively less levels of activity. Say, sometimes you might even get breathless when you're sitting at home watching television, and sometimes you might get breathless when you're lying flat in bed, and that might make you actually sit up bolt upright in bed. That might actually even wake you up from sleep, for example, sometimes. So that's the second important symptom. The third important symptom is, of course, palpitations. This is something that somebody might just feel. You might feel your heart racing away, fluttering. So if it's fluttering very, very fast, it's a rhythm which is commonly known as atrial fibrillation or atrial flutter. And these are irregular rhythms that come from two of the chambers of the heart, which is known as the atria, which collect the blood from different parts of the body and supply that into the pumping chambers of the heart. So the atria are the two collecting chambers, and when these go into funny, instead of beating in a synchronized fashion, like 80 times a minute, they go into a funny rhythm called atrial fibrillation, which causes them to beat at like 200 to 300 times a minute. So that can be pretty unsettling for somebody who is just sitting at home watching television, or indeed running on the treadmill, or indeed watching their favorite show, or even might wake them up from sleep, for example. So this is another important condition. And the fourth thing is what we call syncope. So syncope means that you black out or you just faint. So that again is a sign that your heart is not able to deliver enough blood to your brain. So the brain, because it's not getting enough blood, essentially just shuts off and causes it to fall onto the ground. And when you fall onto the ground, the blood then obviously gets to the brain much easier because it's not having to go up against gravity. So that automatically restores blood flow to the brain, and then the person tends to wake up. But these are the four important symptoms that one would look out for in heart disease. Now, in terms of signs, the signs are a little bit more subtle. The commonest signs that you would find is, say, blueness of the fingers. So that means that there's not enough blood circulation going to the fingers or the toes. Now, this could be because of circulatory problems, but again, it could be a reflection of heart disease, in that there's not enough blood going to your peripheral circulation to cause it to remain pink. So it becomes blue. So blueness is one thing. The second thing is, if you fill up with fluid, for example, if you get fluid build up in your legs or your hands or on your belly, for example, all these could be signs of heart disease.
So is there a way to keep your heart healthy, like diet, exercise, keeping your weight down, and what are some, things that people can do to keep their heart healthy?
Yeah, I mean, these are very, very, very important features that people have to do to keep their heart healthy, and it starts essentially from school, for example. So even in the schools, they can do so many things to keep heart healthy. For example, instead of feeding children regular pizzas and donuts and burgers and all the good things, and the fries and all the good things that people like, maybe focus on more heart healthy options starting at a younger age. For example, we know that adolescent and teenage obesity is a problem, and these are frequently a predisposer of heart disease at a younger age. So if you develop obesity in adolescence and in young adulthood, then that can be a harbinger of problems to occur in later life. So you start off with watching your diet even at a very young age. Parents can encourage their children, while having the so-called good stuff, maybe 5 a day of fruit and vegetables, for example, will certainly go a long way. And that's one important. The diet is one thing. The second thing is to watch your weight, and we go by what is called the body mass index. And I think that's a reasonable way of looking at weight, because a person could be 70 kilos, but then if a person is very tall and lean, 70 kilos or 150 pounds is probably okay for him or her. But if the same person is a 13-year-old or 14-year-old and weighing 70 pounds, that's probably not, or 70 kilo, 150 pounds, that's probably not a good thing. So, I mean, this watching the weight is an important thing. So for that, we use a BMI cutoff, and typically a BMI of between 23 and 27 is probably what is thought to be reasonably good. Once you start to go beyond that, is generally perceived as being a little bit overweight. And then there are ways to cut back on that. So you watch your diet. There are certain medications that can help with diet. Different types of diet can certainly help with it. A diet that is more wholesome, with more protein can help with that, for example, rather than rather than having more of carbohydrates or fatty foods. So these are the ways that one can watch your diet to stay heart healthy, as it were.
Very good. Learning lots here on Ask the Doctor on SSP TV. When we come back, Dr. Mahesh will talk about the surgeries, non-invasive ways, approaches to the heart surgeries. We've come a long way in medicine, so stay with us here on SSP TV. Welcome back to SSP TV, Ask the Doctor. We're here with Dr. Mahesh. He is with Penn State Health, a cardiac and transplant surgeon. We're happy to have him on here to inform you about keeping your heart healthy. Now, if we get to a point where you need heart surgery, again, Hershey is so close to the Hazleton, Pottsville, Wilkes-Barre area. And I know for me that if I need heart surgery, I want to go to someone that I can trust. And that's a really good reason of why you should be watching the show and learning about what doctor has to offer, about his qualifications, his experience, his background, because I'm willing to travel anywhere for my health. I know you guys are close, but I know people in this area would travel for their surgeries. So doctor, if you can explain some of those heart surgeries that you do, the time of healing I would think is a lot less long than it used to be. So explain that to us.
Absolutely. Thank you. So I, at Penn State Hershey, I offer the entire gamut of heart surgery, be it double, triple valve operation, be it aortic surgery, be it replacing one or more valves, be it treating irregular heart rhythms, or be it treating the diseases that affect the arteries of the heart, for example, the bypass grafting, if you like, or be it any complex reconstruction that you need for the heart, or be it any devices or machines that you need to support the heart, called the ventricular assist devices. So I offer the entire spectrum of that in my practice. And some of these cases can be quite complex to perform, and it all depends on what conditions the patient comes in and what the presentation is, what the different investigations show. Say, for example, any patient that comes in with heart disease will have investigations performed. He or she will typically have an echocardiogram, which will show the different valves inside the heart, and it will show the state of the pumping chambers inside the heart. And then he or she will go on to have an angiogram, which will tell us about the state of the arteries that provide blood to the heart. And sometimes they will go on to have a CT scan, which will tell us again about the different arteries around the heart that may need attention. So typically we will do all these investigations beforehand. We will also do investigations on the lungs, for example, to make sure that they spend as little time as possible on the ventilator, because that is again important. Once you have major heart surgery, if your heart recovers fine, but you're stuck on the ventilator for a very long period of time, that's not good for you. So we will do all these investigations to make sure that the patients are as good as possible to be able to proceed with their heart surgery. So once we decide that, typically we can do heart surgery through a variety of approaches. Most of the operations are done through a sternotomy, which is an incision which goes through the center of your breastbone in the middle of your chest. But occasionally, depending upon the patients, for example, we can also do more what you call minimally invasive surgeries. That means that you give keyhole surgery through the side of the chest, for example, be it the left side or the right side. You can do it through smaller incisions, and we also provide that service at Hershey. So we can approach the heart through smaller incisions, again, depending upon their condition.
Now, doctor, before you go on, that's very important because Penn State Hershey is the only one that does that. That's like your niche, right?
Right.
Going in from the side. And that's really important for the patient because that helps with recovery time.
Absolutely.
Right. So
Absolutely.
Keep that in mind because this is something that might be foreign. But again, you want to ask these questions when you meet with your doctor, either the front of the chest or the side. And that's something that only you guys do.
That's correct, yeah.
Okay.
So So again, it depends upon the type of patient, but we can certainly visit that scenario in every case, and we can talk about it, whether that approach is feasible for any given person or not.
Okay.
And we can certainly perform a lot of complex operations, even through a small keyhole incision on the side.
Okay. And you're very qualified. You do all those all the time.
Right.
Okay.
Right.
What about heart failure treated with machines for surgery? You had talked about that. Is that something that you have to watch with lung capacity? You were explaining.
Yeah. So I mean, so I also specialize in special devices that you put inside the heart to either to promote recovery. So, for example, some people might get a bout of viral infection that critically affects the heart. But these people, if you support them with either medications or even a smaller device, which you can put in through one of these keyhole techniques, you can support them for a few days on that particular machine while the heart just recovers on medications. And at that point, we can then wean away those particular medications and let them go home. And without them having had any major sternotomy or anything like that, just by keyhole surgery, they can go home, having recovered their heart. Sometimes, of course, their heart is not recoverable because it's just sustained so much of damage. So in these people, what we can do is we can again optimize them to a state where they can have a more durable machine support, like a ventricular assist device, or indeed they can be listed for transplantation, and based on a suitable organ donor being available, we can transplant them at a later date. But again, sometimes when people come in a critical state, they're not in a shape to have a major procedure done. So they need a smaller procedure done through keyhole surgery, whereby they can be supported by a device called an impeller, for example, that temporarily supports the heart while rest of the organ systems get better, and they can be then streamlined into either the long-term ventricular assist device pathway or the LVAD therapy, or they can be offered a transplant.
So don't neglect your heart, because what you're saying is the longer you let a heart problem go, then the more work you need done, and that could save your life.
Absolutely.
All right. So again, we're with Dr. Mahesh here on SSP TV. Ask the Doctor. If you have any questions, you could let us know, and you can also contact Penn State Health. The way to get a hold of Doctor, we have two numbers that we're going to put up on the screen for you, and they are 717-531-8330 and 717-531-8329, and Doctor's email is also up on the screen. If you had any information that you wanted to share with Doctor, any questions that you had, you can certainly phone or email, and we're hoping that we've given a lot of information, help save someone's life on the show today. Doctor, anything in closing?
No, like I said, like we've been stressing all through the show, the important thing is to take care of your heart. And I would like to thank Jeannine, and I would like to thank SSP TV for hosting this show. I really appreciate the opportunity. Thank you.
All right, and you're watching Ask the Doctor right here on SSP TV. We'll see you next time.